This is Elected, a podcast for women in and around politics. I'm your host, Sarah Elder Chaminara, and this week my guest is Dr. Eliana Castillo. In the spirit of reconciliation, it's important to me on my personal journey to acknowledge and share that I am personally and professionally committed to learning myself and teaching and sharing with others the history of colonialism and the ongoing systemic violence against Indigenous peoples, and to help in whatever way I can to dismantle it. This land is not mine or yours. The land on which I live and work is the traditional territories of the Blackfoot Confederacy, the Siksika, the Kainai, Piikani, the Tsuut'ina, the Stoney Nakoda Nations, and Métis Nation Region 3. So today is a very special podcast. I'm very lucky to be able to have Dr. Eliana Castillo joining me. Dr. Castillo is a clinician-scientist here in Calgary, Alberta. Her medical practice focuses on reproductive infectious diseases, medically complex pregnancies, and hard-to-reach populations. As a scientist, she partners with patients to understand their journeys through parenthood and engage in a dialogue about interventions that can protect mothers and babies through things like vaccinations. Dr. Castillo is a clinical associate professor at the Cumming School of Medicine at the University of Calgary. Dr. Castillo, thank you for joining me today.
Thank you very much for inviting me, Sarah.
So the reason why it took a while to set this up, but it was because we had to find the right person, and then also you're very busy. So the purpose of today's podcast is specifically, it is not, some people will say this is political, but it's not actually. It's around discussing common misconceptions and some fact checking, and some myth busting around COVID misinformation and pregnancy. And you are the best person to do this podcast with because of your focus, your daily work in this area. So would you mind just telling people what it is you do on a daily basis, and then we'll get into the conversation around some of the questions and answers that we have.
Thank you, Sarah. So, Sarah, I've been mostly a frontline clinician for many years. In my daily clinical work, I see people who are either pregnant, planning a pregnancy, or just had a baby and they have a medical complication. So I see things from, women who had a kidney transplant a few years ago and now they are having a baby, to people that were pretty healthy and now they've had, they have super high blood pressure in pregnancy, or they are developing a new disease. And I also train in infectious diseases. And so I work very closely with colleagues from obstetrics, and when there is, so for example, you go for your ultrasound and there is something abnormal on the ultrasound, and we say, okay, could this be Zika, right? I kind of help with investigating kind of the infectious causes behind things like abnormal ultrasounds. For the last 6 years, I've been doing a fair amount of work on vaccinations in pregnancy, and that really came from the fact that, again, I, at least once a year, we get a pregnant person in the intensive care unit with influenza, which, you can argue is totally something that is preventable because we have a vaccine that works for influenza, and that has been recommended for pregnant people for 10 years. So that really got me thinking about how sometimes knowing, having something that is available to us, knowing that works, doesn't necessarily translate on actually, as a physician or as nurses or as healthcare providers recommending that, or as a patient actually taking that. So there is always that gap between knowing and doing. And then once the pandemic started, COVID-19 has really overtaken us. So one of the things I've been doing during the pandemic is there is a registry that looks at every case of COVID-19 infection in pregnancy, and we have been looking and trying to understand what does it mean to have COVID-19 for a mother and a baby.
Mm-hmm.
That has been a very sobering experience to just take the big picture and the numbers and see how the how COVID-19, like any other respiratory virus, can seriously affect the health of the mom, and by affecting the health of the mom, affecting the health of the baby, but also how things have changed as the variants of concern have emerged. So I have worked in the in the COVID-19 units in the hospitals in the city where we take care of people who has COVID-19 infection. So that's kind of what I do.
Mm-hmm. And I just want to preface this. I should have mentioned it earlier, that one of my motivations in trying to, because I actually went through a bit of a journey. The doctor that I initially reached out to was like, no, actually, I think I know someone better than this. And then somehow it magically ended up coming to your office. But my motivation in wanting to do this podcast specifically was just as a person, as a mom, as a person, a woman. It's been really upsetting to me to read some of the stories that have been made public about women who are pregnant in BC and Alberta and across the world, around the world, and how COVID has affected their pregnancies. And I don't think that there's any woman who could be listening to this, or just any woman, hopefully in general. I mean, we go to extreme lengths, from taking, horse-sized prenatal daily vitamins, which are those were not my friend during my pregnancies, to, we safeguard ourselves so much when we find out are pregnant, and some women go to such great lengths to even get pregnant. So to read the stories about women being intubated during their pregnancies, and then, having their babies delivered without, and they're still unconscious, that was really upsetting to me. And so my motivation today is to really talk about this, and hopefully we can reach someone who maybe is a little bit skeptical, and needs kind of some extra reassurance that the science is safe, and that this is something like taking a multivitamin. It's just something else you do now to keep your pregnancy and your baby safe, as well as yourself. So let's just start with, I think maybe the number one asked question is it safe to get the COVID vaccine when you are pregnant at any stage?
Yes, Sarah. And I as a physician, we were trained to never say that something is safe. And I think the reason we were trained to say that is because science is not perfect, mm-hmm. right? And there is so much we know today. I think, however, that rigor to always keep some skepticism, some healthy scientific skepticism. I think it has not served us well during the pandemic, because when it comes, so as you mentioned, pregnancy is a very emotional time in our lives. As soon as we're pregnant, we are overcome by that sense of protecting a new life, and mm-hmm. and every decision we make throughout pregnancy is it seems so big when we're there.
Even eating sushi, for example, right?
Eating sushi, the vitamins,
so deli meats, vitamins,
broccoli, because it makes my baby gassy. Like, everything suddenly becomes so big, and mm-hmm. So I think when you're pregnant, you're already very emotional, and I think the fear is also a very strong emotion, and it propagates very easily. So I think when we are trying to have these conversations with women, and I come with my healthy scientific skepticism, and then there are all these very emotional appeals, against science, then I think we're in a difficult place. But sorry, I'm digressing. Going back to your question, okay. Are they safe? Mm-hmm. They are safe, Sarah, and they are safe. And I can, as a mother of three, and who actually got vaccinated herself, and and actually supported my 18-year-old to get vaccinated, is we know enough to move forward. And maybe that's the big message. Do we know enough about the COVID-19 vaccine, the mRNA COVID-19 vaccinations in pregnancy, to recommend them as a good strategy to keep mothers and babies healthy from COVID-19? And the answer is yes, we do know enough to make that recommendation. Do we know everything? No, we don't know everything. And there is no way we can know everything, but we do know enough to move forward. And I will tell you why we know enough. So, number one, even though the COVID-19 mRNA vaccine is new, there are at least 10 years of vaccine specific work on infectious diseases using mRNA vaccines for other diseases like Zika, like Ebola, like influenza. So the platform per se, the idea to actually give our bodies the instruction to make something like the spike protein was not invented in 2020. It was already available, right? So that's number one. Number two, all the scientific work that has to be done in animals, and kind of the reproductive studies to know if a vaccine can be given in pregnancy or prior to pregnancy, and how it affects pregnancy or not, and the development of babies as they're born. So all that animal data was done and was very, very reassuring. Number three, there were, during the licensing trials, so even though pregnant women or pregnant patients were excluded, which is a shame, and we'll talk about that later, but were excluded from the licensing trials for the COVID-19 vaccines, there were unexpected pregnancies. Those always happen, right? And
Yes.
And those unexpected pregnancies that happen during the mRNA vaccine trials and for the viral vector trials had the same outcomes between those that actually received the vaccines and actually those that received the placebo. And once the vaccines came out of the gates and they were, a license for the emergency use authorization, there were a lot of, there have been at this point, like thousands, and at this point actually hundreds of thousands of pregnant patients, especially at the beginning, who they did a big risk negotiation. A lot of them were healthcare workers who were pregnant, in the United States. So COVID-19 for them was a reality that would hit them in the face every single day as they would work. And they made the negotiation between protecting themselves with this vaccine versus the risk of getting sick and potentially, very sick, delivering a baby prematurely or dying from COVID. So thanks to that leap of faith that thousands of women take, we now have real life data, what we call post-marketing surveillance, on thousands of people who have taken the vaccine at different stages in pregnancy. And we do know that the vaccine itself, A, it works to protect them against disease. B, the protection that mothers make goes through the placenta and gets to the little one, and those little ones have antibodies when they are born, so they are protected from COVID. And three, we do know that the risk of what we call adverse outcomes, so the risks of something going wrong in pregnancy, among women who got the vaccine is exactly the same and comparable to women who didn't get the vaccine. And this is something that I really want to emphasize. When we, like, pregnancy is not without risks.
Mm-hmm.
when we are pregnant, and this is something we, I like when patients walk through my office, I don't tell them, and they tell me I'm pregnant. I usually say, um, well, good for you. How are you doing? How are you feeling? I don't go through the risk of, oh, well, you're pregnant now. You have a, a 10 to 20% risk of, miscarrying, and a 10% risk of developing high blood pressure, and a 7 to 8% risk of developing prematurely, and a 7 to 8% risk of having a postpartum hemorrhage. Like, we don't necessarily discuss or put the risks, the inherent risks of pregnancy up there. And what is very important to emphasize is that those risks are still there.
Mm-hmm.
If you get the vaccine, the risk of having a miscarriage is still there, but it's the same risk that you have even if you wouldn't have got the vaccine. With the
So it doesn't increase your risk of
that
having a
that's
negative outcome during your pregnancy.
so we do know that the risk of so we do know that that mRNA COVID-19 vaccinations do not increase the risk of miscarriage. And there is not only one study that has looked at that, but actually there are several studies. And there is the first one that came out has had a lot of bad press because they made a mathematical error on the first. But we have several studies after that using a more powerful methodology that have documented that COVID-19 vaccinations do not increase the risk of miscarriage. They do not increase the risk of congenital malformations, do not increase the risk of having a baby prematurely, do not increase the risk of having a smaller baby. And we do know that there is data that is coming up that is showing that women who get vaccinated have a lower risk of getting admitted to the hospital or landing in the intensive care unit. And just to give you, every single pregnant mom we have had in the intensive care units in Alberta has been unvaccinated.
That's I think you should say that again, because I think that's a very, very, very important thing. Do you mind sharing that fact again?
Absolutely. So every single pregnant patient who has gone to the intensive care unit in Alberta has been unvaccinated.
So they haven't been vaccinated, and that makes up the entire population of pregnant patients who have been in the ICU in Alberta.
Correct.
Yeah. Which is that's upsetting because, and hopefully it's conversations like this and the ones that I know that you're having with groups across the province to encourage people to get vaccinated and also to share this information. So I also know that from your work, you're actually involved in reviewing the charts of every pregnant woman in Alberta who has COVID. So not before they get to say to the ICU, but just every woman who has COVID in Alberta. And I believe that there's you've had some. Can you just tell me what that's like to review those charts and maybe to share something that you've from your experience of reviewing that and how that's impacted you and how it's impacted those people?
So Sarah, so we have seen how, so through that exercise, even 1 year ago, we already learned that COVID-19 for about 75, and this is the baseline variant, for about 75% of women, it was a mild infection. So it would be the sniffles. For 25% of women, they would have more symptoms, and a percent of them would go to the intensive care unit. That was a year ago, November of last year, kind of the wild type or the baseline variant. With the UK variant, we saw a sharp increase on moms who actually would be symptomatic enough, and would feel bad enough to actually go to the emergency room, and because they were so pukey and dehydrated and tired, and their heart would be super fast, and baby would also be like the heart of the baby would be going fast as well, etc. And then with the Delta variant, the proportion of women that actually get symptoms goes to the emergency room and goes to the intensive care unit has increased. So we certainly have, like, by going through those charts, we have seen the change on how a year ago it was already serious, and we were able to say that actually the risk of hospital admission or the risk of admission to the intensive care unit was 3 to 5 times higher than if they wouldn't be pregnant. But with the variants of concern, we have seen how that risk is, some people have scored it even 10 times higher. And reviewing those charts is so humbling and so painful, because I see positive test goes once to emergency room, twice to emergency room, 3 times to emergency room. Eventually, she calls CMS and she's lacking oxygen, and then you see the record, you see how fast it deteriorate. And this is something that most pregnant people are healthy, right? And they can compensate. So they get COVID and they can hold it, until there is a moment where they cannot hold any longer and they crash very fast. So we have seen moms that go to the emergency room 5 times, and eventually the 5th time they just go straight into the intensive care unit. But we also have seen moms that actually they stay at home, and they, for different reasons, they don't want to be tested. In some communities, there is a lot of resistance to get tested, and families don't necessarily want to get tested, or they don't want their family members to get tested. There is some resistance to even believe that COVID exists. So I see, for example, how those moms, when they call the ambulance, is when they are in very bad shape. And then reading the stories about those moms getting a cesarean section in the intensive care unit, and some of them waking up 4-5 weeks later, very debilitated after having been hooked up to a breathing machine for weeks, right? They wake up to find out that they're not pregnant any longer, to learn that their bodies are just ravaged by the disease and all the complications, and some of them going home to find these, a lot of the time, premature baby who they haven't been able to bond for weeks at a time. It is so painful, and I can imagine it is painful for me to see those trajectories, but I cannot imagine the pain that they go through, or even having the conversations with their husbands. Those conversations when we have had moms who are at that gestational age where is very premature, like 24, 25 weeks, and then I have had these conversations with my colleagues who have to talk to that dad and say, well, there is a chance that maybe if she gets delivered now, she may do a little bit better, but baby may not make it. So imagine being a father and having that conversation. It's mind-blowing. And yes, Sarah, we have to acknowledge that doesn't happen to everyone. Fortunately, that is, you can say, the minority of patients, even though we have seen a big increase with the Delta and the UK variant. But the reality is that it doesn't have to be like that.
So what would prevent situations like that?
So, well, vaccination.
Mm-hmm.
Vaccination. So so vaccination is crucial. Number 2, but I think we also have to acknowledge, Sarah, that vaccination is not our one ticket out of this pandemic. That we also need to layer other measures on top of vaccination. And so masking remains important, incredibly important.
Especially, and so for pregnant women as well, masking is important.
Masking remains very important for pregnant patients, and the concept of of big gatherings. I cannot begin to tell you. It's just at the beginning of the pandemic, many moms, many women who actually were able to work from home say, I'm working from home, which again is not an option for many women out there. There are women that have to go and
essential workers, people who work in grocery stores,
absolutely,
restaurants, people. Yeah, it's not a pandemic. It's a pandemic that also specifically targets people who lack the privilege of being able to work from home.
Absolutely. So, and keep in mind that a big proportion of our front line workers
are women.
Are women, and are women of reproductive age. And women, a lot of the time from visible minorities, they don't have an option, right? Like they are cleaning our hospitals, they're making our food, they are working in our supermarkets, they are taking care of our children, they are taking care of our elders, right? So
they're not just vulnerable health-wise, but also financially.
Financially, absolutely. Yeah. So, but even for those moms, and I can tell you this looking at my data, at our data in Alberta. So even for those moms who were able to, work from home, we saw so many times that even if the husband had to go and work, right? Because again, it's the reality for many that the husband, even if she could stay at home, he would have to go. We could see how they could get infected from husband. And now that the vaccinations are available and more people is vaccinated in the community, but now I still see it how I just had a case of a young mom that it was her brother. Her brother came for a visit, right? A couple days later, her 4 or 5 year old got very sick, and then 10 days later, she's in the intensive care unit. Right? A healthy mom, a healthy mid-20s mom with a 4-year-old that goes from, happy seeing her brother to being in intensive care unit with the Delta variant 10 days later is really mind-blowing. So again, vaccination for herself, vaccination for her brother, vaccination for her husband is important.
Yeah. Well, especially because in that factor as well, the three adults in that equation, the brother, the mom, and the father, all have the ability to be vaccinated, right? Correct. It was actually the child, the 4-year-old, who being the one that in that situation, it wasn't just the unborn child, but it was also that small child who are the most, they're very vulnerable in this situation.
They are. And that is, again, and this is something, there is another trend that I have learned looking at the data. So I have seen also moms who, they're pregnant and, they don't get infected during pregnancy, but they come back to the hospital day 4, 5, or 6 after having delivered a healthy baby and a healthy mom, and they come back with COVID. And so we have seen a good proportion of what we call those early postpartum infections. So they may go home, they're happy, they're maybe seeing more people come to visit, meet the baby. Next thing we know, they catch COVID. And some of those moms, like we have had at least a couple months who actually have required intensive care unit in the postpartum period, right? So they were in those first 1 or 2 weeks after having a baby when, and it, Sarah, you may deliver, but your body, right? Like your body is still pregnant, right? Like all the hormones, you're still, your legs may still be swollen, right? It takes, so even after delivery, like all the things that make pregnant people more susceptible to get sick from COVID-19 are still there. So I have seen that story of moms who get COVID or get infected with COVID after they deliver their babies, and some of them getting very sick because their bodies are still with all the changes of pregnancy and passing the infection to their newborns once they are at home.
So masking, hand washing, maybe, keeping to, so, those really uncomfortable conversations around not having family over, not holding the baby. Those are still very important in these situations as well, on top of being vaccinated.
They remain important. We're not done until we're done, Sarah. And we're just not done until we're done. And it's hard. I mean, I can't imagine being pregnant nowadays with everything that pregnant entitles in the middle of the pandemic, and then without, right, all the support, our friends, our girlfriends, our family members. It has to be very lonely.
Yeah. I think as hard as that may be, and not having, those people around you initially, it goes back to the basics of keeping that baby and yourself safe, because they're so small, they're so precious, they're so helpless. They're just, you take such care during pregnancy, and after you have them and you meet them and they're so small and frail and vulnerable, and you want to do everything you can to protect them. So sometimes, but the things that you think might actually be most helpful might actually end up hurting them, unfortunately.
And one thing, Sarah, in all this conversation about pregnancy is that for 40 years now, more or less, since the thalidomide, and again, I know that many young moms out there that are not necessarily, aware of that, the thalidomide scandal, but there was this medication back in the 60s, and and this is actually before the FDA, or Health Canada per se existed, that was promoted as a medication for nausea and vomiting in pregnancy. And many young moms had it in the 60s, and shortly after it became apparent that it was causing birth defects. So the paradigm went from just when you're pregnant, you don't put anything on your body, right? I think we're still in that paradigm. And it's not only moms who feel like that. Doctors and nurses and pharmacists are still, and especially, if I talk to colleagues who are 60 years old, and, when they were going to med school, they remember those awful pictures of a thalidomide baby. They are still asking me, do you really recommend this vaccination for pregnant women? So our paradigm, the way we think in pregnancy is that we don't put things on our bodies. But I think what we are in this stage and age, it is really apparent that probably one of the best things that we can do to keep ourselves healthy in pregnancy and to protect our babies is to put something in our bodies, is the vaccination. So there is a paradigm shift, and it's not a new idea, Sarah. It is not a new idea, because I don't know if, but anyway, there is a disease called tetanus, right? That, we get the tetanus, everyone, we're doing gardening, or, we go, or, we need stitches. We go to the hospital and, we get our stitches and we get a tetanus shot, right? So the tetanus used to kill thousands of babies and moms in the world, right? So moms, even today, in many places of the world, women give birth in the jungle or little huts, right? And
they're not giving birth in, the women's hospital in Vancouver or at, Rocky View in Calgary.
Absolutely, they give birth. So it was 30 years ago that, the tetanus vaccine already existed, and the WHO said, probably the best way to protect all these moms and babies from tetanus is to ensure that every young woman, right, who may be having babies, actually make sure that she gets the tetanus shot. So massive vaccinations campaigns went across, Africa, Southeast Asia, etc., for tetanus, just to make sure that if we would vaccinate mom against tetanus, she would have the antibodies, right? She would make the antibodies, she would pass on the antibodies through the placenta. And in that way, when baby was born, even if baby was exposed to tetanus, right? So let's say the cord was cut with a hunting knife, which is actually what happens, right? Or
something that's not sterilized.
that's right. So something that is not sterile, then that wouldn't kill baby, right? Because baby would have been born with the protection against tetanus, thanks to the fact that mom got vaccinated. So that whole concept of vaccinate mom to protect baby is really not a new one. And thanks to that concept, we have been able to, to almost eradicate tetanus from all countries of the world except 10 of them. And same thing with influenza. Same thing with influenza, or the same thing with whooping cough. So this whole thing of protect mom, or of vaccinate mom to protect baby, is incredibly efficient.
What about on a slightly different topic? Because I've also heard some male partners talk about fertility and the COVID vaccines. So, does the COVID vaccine for anyone, but specifically moms, but also their partners, does it affect fertility in any way? If you get the COVID vaccine and you're planning on having a child in the future, would that impact it?
So no, even though fertility markers were not looked closely in the licensing studies, we have data now that shows that, for example, men who have got vaccinated have compared, actually, for example, the sperm counts of men before and after vaccination. It has shown that it hasn't changed, right? So after the vaccines came out, and the myth, and I have to say, let's say the allegation that fertility could be an issue has prompted a lot of science of that. So fertility clinics across the world have actually had samples, for example, of both men and women, like eggs from women, sperm from men, before vaccination, have been able to study real time what happens. So there are at least 3, if not 4 studies right now that have specifically looked at the sperm count, and a sperm count in men is not affected by vaccination. And for women, there is also at least 3, if not 4 studies that have looked at the hormones that actually help a woman to prepare an egg, right, in preparation for pregnancy. And those hormones are not affected by the vaccine. And also studies that have looked at actually what happens with the ovulation and the egg per se in the presence of the antibodies against the virus, and there is no change on the fertility parameters. And I think it's very important. I think there are 2 things that we need to kind of conceptualize here. And one is that when you get the vaccine itself and the components goes to the muscle, right? The muscle in the arm. And then from the muscle, the vaccine and its components are taken into the local lymph nodes. And I don't know if it happened to you, Sarah, but it happens to a lot of people, that on the lymph nodes, they get like their lymph nodes, or in the armpit after the vaccination, may get big. So anyway, so the vaccine and its components they stay in the muscle and in the lymph nodes, and the lymph nodes are the factories where we make the antibodies. So the vaccine and its components get to the lymph nodes. They do what they're supposed to do, which is to teach your body how to make the spike protein, and then your body makes the spike protein and the antibodies against the spike protein. And the antibodies are the ones that get into the bloodstream. But the vaccine itself and all of its components, they never get into your bloodstream, right? So when moms ask me, well, how do you know? And I say, well, we do know that actually the vaccine itself and its components don't get to the bloodstream. They stay in the muscle, the lymph nodes, and from there, they are cleaned out of our bodies. But the antibodies are the ones that get into the bloodstream and, protect you and, can protect baby if they go through a placenta. So the vaccine itself and its components don't get into the ovaries, right? And I know there is a lot into the social media. Well, what about if the vaccine accumulates in the ovaries? The vaccine doesn't accumulate in the ovaries. The vaccine and its components doesn't travel from the muscle in your arm into the ovaries, right? So that is something that is important to understand. And but as well is actually where the myth of fertility came from. This whole myth about the COVID vaccine affecting the fertility, it came from an allegation that two scientists who used to work with
In
one.
quotation marks, let's just be clear.
That's right.
Yes.
That used to work with the scientific that were former employees of one of the companies, wrote a blog. They wrote one blog in December about the fertility concern. And their allegation was that there is a protein that normally placentas make at about 13, 14 weeks called syncytin. And they made the allegation that the spike protein of the virus looks very similar. That's what they said, that the spike protein looks very similar to this syncytin protein that the placenta makes. And then if you get a vaccination against the spike protein of the virus, then those antibodies that you make would it would misfire and would get confused and attack this placental protein, and hence pregnancies would not progress. So that's what they claimed.
And this was a blog post.
And it was a blog.
This wasn't a medical journal. This wasn't reported. It wasn't scientifically verified. It was a blog post, something that you or I could just go onto the internet and make.
Absolutely. Allegation. It was an allegation. It was not a study. And from that, it snowballed. But when you look at this, when you think about it, so the syncytin protein and the spike protein, so they're proteins, right? And they are made of little blocks. So syncytin has 700 blocks and the spike protein has 1200 blocks. They share 4 blocks in common. 4, right? Out of 100 blocks that they're made of. So they are not that similar as they made it claim in the allegation. That's number one. And number two, in order for a person, or in order for a person to make syncytin, you have to be pregnant, because syncytin is a protein made by the placentas and it doesn't kick in until 12, 13, 14 weeks. So how can you claim that this alleged crossfire between the spike protein antibodies and the syncytin can affect fertility if in order to produce syncytin you have to be already pregnant, right? It doesn't make sense. The allegation that they made at the beginning in a blog post that has not been backed up by any scientific study, it grew from something that could potentially affect pregnancy to something that could affect fertility. And here we are 10 months later, and many people actually very concerned about their fertility and not getting protected or protecting the ones around themselves.
Well, also connected to fertility, and something that I've heard is around COVID and menstruation. So women getting their menstruating. So does the COVID vaccine, because I've seen things on the internet that have said, oh, I got the COVID vaccine and then I didn't get my period, or it was late, or it was longer, it changed. I can tell you as a woman that my period is very inconsistent on a month-to-month basis. So that's something but in the context of the mRNA vaccines, does it change? Are there any changes to menstruation as a result of receiving the vaccine?
So yes, there are, and I think there are there are, and we know about them because many women have told us about it. It was not a side effect that was recorded on the licensing studies. And I'm glad that actually so many women have come forward to say, it changed my period for, my period was different that month.
Instead of starting on Tuesday, it started on Thursday.
There you go. Or it changed, or maybe for that cycle was different. And I think that has prompted funding to specifically look at those very specific women's health issues that should be looked up. I mean, it is important. Periods are important for women. So
without them, there would be no children. Like that's a whole other podcast, to be honest, is around talking about periods, because they are so fundamental, and it's something that there's so much shame attached to.
Right. And we don't talk enough about it. But they're very important. So anyway, there is funding committed, particularly coming from the US, to actually study in a systematic way what happens with periods and COVID-19 vaccines. What I can tell you based on what I have heard from my patients is, and patients and colleagues and doulas, midwives, and that I have had the opportunity to work with, is that not all, but for some women, they may have a strong inflammatory reaction. And I say, some people get the vaccine and they feel crappy, for a day, right? You get the muscle aches, you get tired, you feel like you have the flu, and then you're better. That same inflammation in your body, which is really your body responding well to the vaccine and making the antibodies, right? So it means the vaccine is working. That same inflammation can affect your period. And what is very important is that the periods go back to normal and should not affect your fertility. So is it possible that the inflammation reaction that you get after the vaccine, meaning that the vaccine is working, changes your period for that cycle? Yes, that is possible. Has it been reported? Yes. Is it does it happen? How often does it happen? We don't know, because we didn't properly, it wasn't properly studied. It is being studied now. But what I have heard over and over again, even from those women who reported that their periods change, is that they go back to normal.
So maybe in a situation, and maybe this is for anyone who's menstruating, that's listening to this, and they have they notice a prolonged change in their period, in their menstruation, that would probably be something that you should talk to your doctor about then.
Absolutely.
Right.
Talk to your doctor about it, because there is no reason for which these vaccines should affect your period on the long-term basis. So please, if your periods are abnormal for cycles on end, please see your doctor. It's not the vaccine.
That there could be something else that you should talk to your doctor and investigate with them.
Absolutely.
Okay, that's really good information. Maybe we're almost done for time, but is there anything, is there maybe another anecdote that you can share to maybe to help people understand the importance of why women who are just women need to get vaccinated, especially women who are contemplating, who are having a conversation around having a baby or are pregnant, to kind of put it into perspective once again, because I think just saying, vaccines are safe and you should get vaccinated, and it's not just about you, but also your child and, your other children as well. But I think that hearing those stories specifically makes a more compelling case sometimes than stone cold facts. So is there one that you could share that that people can maybe think about and understand why, again, it's very important to get vaccinated?
I think that is okay. Well, two stories. So one story on fertility.
Okay.
It doesn't specifically address period, but it's a good story. Very good patient of mine. I had met her during prior pregnancies for something not related to COVID, but anyway, she really struggled for many, many years to, conceive babies. And as you said, she went to great lengths and, in vitro fertilization to have her older 3 children. So in the summer, she, because, she has 3 kids of a school age, right? In the summer, she got vaccinated against COVID-19. And 2 or 3 weeks after the second dose, she found herself pregnant the natural way for the 4th time. So there it goes to show that I can tell you for sure that there is a lady out there who struggled with fertility for so many years, had 3 in vitro babies, got vaccinated, and happened to conceive her 4th big surprise baby even after having the vaccine. So in the same way, so real life story about fertility.
She must have been thrilled.
Oh, she was thrilled, and really, I think both of her husband were really taken aback.
I'm sure they were if it was a surprise.
Big surprise baby.
Yes.
But anyway, regarding the what I call the risk negotiation, I think, as hard as it is to realize it, there is not a risk-free choice in anything we do. When we are choosing, or when a pregnant person or someone who is breastfeeding is choosing not to get vaccinated because of fear of the long-term side effects, like, will my baby have separation anxiety in 4 years from now because I got the vaccine, and we haven't, studied babies for 5 years to know if that can happen, right? So that so she's not getting vaccinated because of the fear of the risk of long-term side effects, right? But choosing not to get vaccinated also has some risks, and it's the risk of getting COVID-19 and, multiplying her risk of hospital admission or admission to intensive care unit by 10 times. So it's not by choosing not to get vaccinated because of fear of the unknown, we are choosing the risk of what we do know it happens. We do know that COVID-19 in pregnancy increases the risk of hospital admission, increases the risk of intensive care admission, increases the risk of prematurity. In Alberta, about 8% of babies before the pandemic were born prematurely. Among the mothers who have had COVID-19 infection in pregnancy in this province, the risk of preterm birth is about twice that, 13, 14%. So the risk that COVID-19 poses to moms and babies is a real risk that we have seen now. We do know for sure it happens. So maybe that's a big takeaway. There are no risk-free choices. Do we know enough about the vaccine and the protection to move on? Yes, we know. And to all the moms out there, I cannot tell you that I know how you feel, because I had my babies, almost 15, 20 years ago. So I don't know what it feels to mother in the pandemic, but I do know the uncertainties that we face being mothers ourselves, and how we are always worrying that whatever is happening with our children is because of something we did or we didn't do. I had a 3-year-old who didn't speak, who didn't have many words until he was 3.5. And I remember spending nights on it thinking, was it that I worked too much? Was it that I get the flu shot when I was pregnant with him? Was it that I did this and I did that? Eventually his language came in, and he's 16 years old now and writing a book. but I do know how it feels to worry about what's going on with our children and how everything makes a difference or not. But I tell my moms, there is no risk-free choice, and we have to do a risk negotiation. And really, I'm not here today to tell you what to do, but I'm here today to say, please, if you are very scared about getting the vaccine, please ask yourself, what is it that you're so scared about? And maybe talk to people who has had the vaccine, and maybe talk to people that actually, to moms that have had COVID-19 infection in pregnancy. Those stories are also out there. Read about them, listen to them, and try to make your best choice possible.
And maybe also, I think, and also just, if you do have more questions and you've listened to this, or someone who's questioning getting vaccinated, encourage them to speak with their doctor.
Absolutely.
Yeah.
Absolutely.
Well, thank you so much for taking the time to speak with me. You are amazing. The work that you're doing, thank you. It's interesting. I was listening in the car yesterday, not to a podcast, but to just the radio. And there was a doctor from the US who is doing some kind of work and investigation around the use of the word hero in the context of the pandemic and healthcare workers, and how some doctors may identify that with, themselves, and then others won't. Anyways, it's all very interesting. But I definitely do think that, in the early days of COVID, we very quickly realized that there were some people to look up to leading the charge against COVID. So Dr. Dina Hinshaw, Dr. Bonnie Henry, Dr. Teresa Tam, all of the chief medical officers, and in particular women, because there has been kind of an awareness raising around, how many women are in science and how many women are dedicated to COVID. But yeah, your day in and day, COVID does not take a holiday. COVID does not take a weekend. COVID does not recognize political affiliation. COVID does not care about anything. It just cares about spreading and multiplying. And your work on a daily basis is solely about preventing that, and also helping women on a daily basis just with their pregnancies. And so I definitely do think you fall into the category of heroic, just because it's amazing to me. And as a non-sciencey person, it's just incredible to see what you do on a daily basis. So thank you for joining me today. It's been an absolute pleasure. So I hope anyone listening has enjoyed this conversation, maybe learned something. I definitely did. And if there's someone that that is vaccine hesitant or vaccine skeptical, and maybe just wants to listen to one person who is not a scientist, that would be me, and one person who actually is and can tell you just the way things are, that you can share this with them. So thank you very much for joining me today, Dr. Castillo, and I wish you all the best with your continued work on COVID and your outreach work to increase the numbers of women who are pregnant who get vaccinated and stay out of the ICU.
Thank you so much, Sarah, and thank you for all the listeners. Take care.
Thank you. This has been another episode of Elected. Thanks for joining us today. Until next time.